with us on Good Morning Arkansas. Now, summer means spending a lot of time outside for many Arkansans, which of course can increase the risk for a tick-borne disease. We have a lot of ticks in Arkansas, and today we have Dr. Thirumal Dubbaka with us from CHI St. Vincent to talk a little bit about the tick-borne diseases in Arkansas, which ones are common, which ones are not. Good morning to you.
Good morning.
You know, we were just talking in the break, and you said you see patients all the time come in and go, I know I've got Lyme disease, and I've been guilty of pulling a tick off my child and saying, we've got to get to the doctor. I'm sure she has Lyme disease. And that's really not the case here.
It is not true at all in Arkansas, or for that matter, most of the south and the south central of the states. And that's because Lyme, just we are starting off all on the Lyme.
Yeah.
But Lyme is mostly north and northeastern disease. And the most common disease in Arkansas from tick bites is Rocky Mountain spotted fever. In fact, I've looked through the statistics from the Arkansas Department of Health, and there have been no cases of Lyme reported in the since 2012.
Wow.
And zero.
Wow.
And we have had close to 265 cases of Rocky Mountain spotted fever, the most reported this year so far.
So much more likely to get this. So talk a little bit about the symptoms of Rocky Mountain spotted fever. We know tick-borne illnesses can be hard to detect.
Yes.
At first.
Yes, I kind of think of it as flu in the summertime, because some of those symptoms are vague and non-specific, and they in fact overlap. Just if you look at it, high fever with chills is one of the early symptoms, along with headaches, and then it proceeds over a period of few days into having what is called characteristic tick-related rash. It is, you can't miss it. It's very distinctive. It starts on the palms and soles and the feet and the ankles and spreads towards the center of the body. It's called centripetal rash.
Gotcha.
So, and this rash itself, it consists of small spots, pinkish small spots, flat, and there's some redness around them, but it is the very characteristic sign of the tick-borne disease, especially Rocky Mountain spotted fever.
How serious is Rocky Mountain spotted fever?
Well, most people, believe it or not, don't end up having the tick infuse the bacteria, it's called rickettsia, into their bloodstream. So most tick bites are harmless, and but when people do get serious infection, it can be fatal. There have been 4 deaths reported last year, and well, that's not too many, but it's about 80% of people who do have a serious infection can die from it.
Yeah, talking about brain inflammation, inflammation of the heart and lungs, kidney failure. This has to be treated. So when do you know it's time to see a doctor?
Well, the way to look at it is, if you have any suspicion, it's better to be safe than sorry. And
you love telling patients, you know what, it's nothing, just a little tick bite, you're going to be fine. Yeah.
But if you have those characteristic symptoms, like we've spoken about, headache and all of those to start with, and then a rash starts, that's usually a bad sign definitely to get checked out. But a lot of times it's just a rash, little irritation, you know, it's probably not anything, but if to ease your mind, it's better to get checked out.
Dr. Dubbaka, is it more common in different ages? Is there one specific age that's at higher risk for this?
Not really. Kids tend to have to be more outside and playing, so you tend to see more cases in the kids, and obviously more concern, but it's across all the age groups.
Talk a little bit about prevention here.
Sure.
We can't lock our kids in the house in the summertime in Arkansas, but what can we do to prevent this?
Definitely. There are 2 things you can do. First off, try to clear out the shrubs or the small bushes and brush around the home. Keep it low so that there's not any room for the ticks to hang out. And the second thing is, I know it sounds kind of counterintuitive, but long pants and long sleeves.
It's hot out there, Dr. Dubbaka.
And I would do this, especially when you're mowing the grass or when you're actually working in those areas, you know, not necessarily on manicured lawns. I mean, long boots and trying to tuck them in. And of course, common sense measures after you come back and just inspect to see if there are any, because if you remove the ticks early on, it takes about like 10 to 12 hours for the tick to be staying on there for the disease to start.
Okay.
So,
and so look for those hidden places. I've always heard behind the knees, behind the ears.
Exactly.
Yeah.
Underarms, groin, the elbow folds. Those are the areas you want to check because those are the moist, warm areas that the ticks love being there. And dog owners. American dog tick is a common vector or the disease spreading agent. So the dog owners should, like if the dogs go out, play around these bushes and come back and check for them too. And just like I said, regular preventive measures and DEET. Don't forget.
Bug spray. It helps every time.
And DEET is a great agent. It's been around for a long time. It is safe as far as we know. And spraying it on before
is going to prevent
those from coming on.
Okay, here's the information for CHI St. Vincent, the Longevity Center West. Dr. Dubbaka, as always, thanks so much for being here. Some good information for all of us Arkansans. Stay with us. We'll be back after a short break. It's a world event.